A world-renowned cardiac surgeon has just revealed a shocking truth. A drug that millions of seniors take every single day could actually be putting their hearts at serious risk. If you or someone you love is over 60, you need to hear this before it's too late. Let's start with a group of medications incredibly common in almost every household: the non-steroidal anti-inflammatory drugs, or NSAIDs. You've surely heard of names like ibuprofen, naproxen, or diclofenac. They're often our first choice for a nagging headache, persistent back pain, or the stiffness of arthritis. And yes, they are undeniably effective. However, using them unchecked, especially if you're over 60 or have existing heart conditions, can be akin to playing Russian roulette with your heart. For years, the medical community has recognized a hidden dark side to these seemingly benign pills. As far back as 2005, the US FDA demanded clear warnings about their increased risk of heart attacks and strokes. Take Roberto, for example, a vibrant 72-year-old patient of mine who adored gardening. He suffered from knee osteoarthritis, and to soothe the pain, he would take diclofenac almost every day. One afternoon, tending to his beloved rose bushes, he suddenly felt overwhelmingly exhausted, short of breath, and his ankles were swollen to twice their normal size. At the emergency room, we discovered he was suffering from acute heart failure. His heart, already working overtime due to his age and mild hypertension, simply couldn't keep up. The trigger wasn't a new heart problem, but the continuous use of that harmless anti-inflammatory. How can something so common be so dangerous? The mechanism is subtle but powerful. NSAIDs work by blocking enzymes that reduce inflammation, but in doing so, they also interfere with substances vital for protecting our kidneys and blood vessels. This leads to two disastrous effects. Firstly, they cause your body to retain salt and water. Imagine your heart as a pump. If suddenly there's much more fluid in the pipes, that pump has to work much harder. A younger heart might tolerate this, but one already stiffened by age or battling high blood pressure can become overwhelmed, just like Roberto's. Secondly, NSAIDs can constrict blood vessels, causing your blood pressure to spike. Even if you're not typically hypertensive, regular use can elevate it significantly. And critically, if you're already taking medication for high blood pressure, NSAIDs can directly counteract their effect, sending your pressure soaring without you even realizing it. It's crucial to understand that the risk escalates with both dose and duration. Medications like diclofenac and high-dose ibuprofen, e.g. 2,400 milliliters daily, are most strongly linked to these problems. Though lower doses of naproxen might be somewhat safer, the risk is never zero. To complicate matters further, if you take a low-dose aspirin to protect your heart, some NSAIDs like ibuprofen can even block its protective effect. So what should you do? The answer isn't to simply endure the pain. It's to have an open, honest conversation with your doctor. Ask them, "Doctor, given my health history, what's the safest pain relief option for me?" There are alternatives. Sometimes acetaminophen, paracetamol is sufficient. Other times, topical anti-inflammatory creams or gels that work locally are an excellent choice. And if an NSAID is absolutely indispensable, the golden rule is always the lowest effective dose for the shortest possible time. Moving on to another widespread medication, and this one might truly astonish you because it's often touted as a stomach protector. I'm talking about proton pump inhibitors, or PPIs, with familiar names like omeprazole, pantoprazole, and lansoprazole. These are among the most frequently sold medications globally. Millions of people take them every morning almost as a ritual for heartburn, reflux, or to protect their stomach from other drugs, like the NSAIDs we just discussed. And here's the unsettling irony. The very medicine prescribed to shield you from one risk might be quietly creating another in the background. Consider Elena, a 68-year-old woman who was prescribed omeprazole for chronic reflux and told to take it for life. Her heartburn disappeared, and she never questioned it again. Years later, during a routine checkup, her electrocardiogram showed something unusual. A blood test revealed the underlying cause. Her magnesium levels were critically low. Magnesium is a crucial guardian of your heart's rhythm. When it's deficient, the heart becomes electrically unstable, much like an orchestra without a conductor, potentially leading to dangerous arrhythmias. Elena's deficiency was traced back to her chronic omeprazole use. PPIs work by reducing stomach acid, But this acidity is absolutely crucial for absorbing essential nutrients. By suppressing it over extended periods, your body's absorption of magnesium can plummet. But the concern doesn't stop there. Several observational studies have also found a concerning link between PPI use and an increased risk of heart attack. One prominent theory suggests that these drugs might reduce levels of nitric oxide, a vital molecule that helps keep our blood vessels flexible and healthy. When nitric oxide is scarce, blood vessels stiffen, setting the stage for a heart attack. While the direct causal relationship is still being debated, the association itself is deeply troubling. Furthermore, omeprazole can interfere with other vital medications, such as clopidogrel, an anti-clotting drug prescribed after a heart attack. It can make this protective medication less effective, leaving patients vulnerable and unprotected. The real problem is how these medications have become trivialized. They were designed for short-term treatments, typically 4 to 8 weeks. Yet they've morphed into a permanent solution for issues that could often be managed with lifestyle changes. If you've been taking a PPI for months or even years, do not stop abruptly. Speak with your doctor. Ask, do I truly need this long term? Can we reduce the dosage? Are there safer alternatives? And if chronic use is necessary, it's critical that your doctor periodically monitors your magnesium levels. While stomach protectors can carry these silent risks, let's turn our attention to something nearly everyone keeps at home, often for the most common of ailments: oral decongestants for colds. Those that contain pseudoephedrine or phenylephrine are often seen as the magic bullet for a stuffy nose that just won't quit. But that magical relief can come at a very high price for your heart, especially if you already have high blood pressure or an existing heart condition. Consider Marta, a 75-year-old retired teacher who caught a nasty cold. To breathe easier, she bought a well-known over-the-counter cold remedy containing pseudoephedrine. By the second day, she started feeling her heart pound out of her chest, accompanied by terrible dizziness and a splitting headache. Her son rushed her to the hospital. Her blood pressure was dangerously high, and she had an arrhythmia. That decongestant had pushed her heart to its limit. Why does this happen? Pseudoephedrine and phenylephrine are vasoconstrictors. Their job is to narrow blood vessels. In your nose, this is great because it reduces inflammation and helps you breathe clearly. However, the medication doesn't act only in your nose. It travels throughout your entire body, constricting blood vessels everywhere. This has two critical consequences. First, by narrowing your arteries, your heart has to pump against much greater resistance. It's like trying to push water through a pinched hose. The pressure inside skyrockets. This can lead to a dangerous spike in hypertension. Second, these drugs are stimulants. They cause your heart to beat faster and sometimes irregularly. If you already have a sensitive heart, this extra stimulation can easily destabilize it. Recently, European agencies have renewed their focus on pseudoephedrine due to its link with rare but serious syndromes involving the narrowing of blood vessels in the brain, further demonstrating its potent body-wide effects. The significant danger of these drugs is their over-the-counter availability. People buy them without reading the fine print or considering the inherent risks. If you are over 60, and especially if you suffer from hypertension or any heart condition, you must avoid them. There are far safer alternatives: saline nasal sprays, humidifiers, or steroid nasal sprays that act only locally. Do not let relief for your nose become an emergency for your heart. Beyond the quick relief of a cold, some medications tackling deeper issues like mental health or chronic pain can also pose significant heart risks, particularly older varieties of antidepressants. This brings us to a delicate yet vital topic: mental health. I'm referring to a class of older antidepressants that are still in use, sometimes for depression and sometimes for chronic pain. The tricyclic antidepressants, with names like amitriptyline or imipramine. Depression itself is a known risk factor for heart disease, making treatment crucial. However, how we treat it matters, and these particular drugs can be hazardous to an older person's heart. Take Francisco, a 78-year-old man who suffered from terrible pain in his feet due to his diabetes. His doctor prescribed a low dose of amitriptyline. While it helped with his pain, he began to feel dizzy every time he stood up. One day, he fainted and fractured his hip. The cause was the amitriptyline. which was causing a sudden drop in blood pressure when he stood, a condition known as orthostatic hypotension. But that's not the only risk. These drugs can also increase your resting heart rate, placing constant stress on an aging heart. More concerning still, they can interfere with the heart's electrical system, slowing down its impulses. This effect is visible on an electrocardiogram and significantly raises the risk of very dangerous ventricular arrhythmias, which can tragically lead to sudden cardiac death. For all these reasons, tricyclic antidepressants are no longer the first choice for treating depression in older adults. Today, we generally prefer newer antidepressants that are considered much safer for the heart. However, they are still sometimes prescribed for neuropathic pain. If you or a loved one takes one of these medications, it is fundamental to have a thorough discussion with your doctor. Have safer alternatives been explored? Are your blood pressure and heart rhythm being carefully monitored? Mental and physical health are inextricably linked. You must ensure that treatment for one isn't inadvertently harming the other. Finally, we arrive at what might be the most controversial point of all, a subject of intense debate in the scientific community: calcium supplements. Yes, you heard that correctly. Those pills that millions of people take daily to protect their bones from osteoporosis. For decades, the message was clear: take calcium for strong bones. However, in recent years, a growing body of research has begun to question the safety of these supplements for your heart. Let me share the story of Lucia, a 70-year-old woman. Concerned about osteoporosis, she started taking a high-dose calcium supplement on her own. Years later, she suffered a heart attack. What made this unusual was that she didn't have the classic risk factors. She didn't smoke, her cholesterol and blood pressure were well within normal limits. As her medical team investigated potential causes, their attention turned to that daily supplement. The controversy is indeed real, and the evidence isn't entirely definitive, but the emerging hypothesis is deeply concerning. Calcium obtained from foods, like dairy products or vegetables, doesn't seem to be a problem. It's absorbed slowly and used effectively by the body. The issue appears to arise with the high, concentrated doses found in supplements. When you take a pill, it creates an artificial spike of calcium in your bloodstream. Your body cannot utilize all that calcium for your bones at once, and the excess has to go somewhere. The main concern is that it can deposit itself in the walls of your arteries. This process, known as arterial calcification, stiffens your arteries and can contribute to the formation of the plaques that lead to heart attacks. Some large studies suggest that calcium supplements modestly increase the risk of heart attack, while other studies haven't found this connection. The evidence is complex, and for individuals with diagnosed osteoporosis, the benefits might still outweigh the risks. But the crucial lesson is clear: more is not necessarily better. The safest strategy is to obtain your calcium from your diet. If your doctor believes you genuinely need a supplement, never start taking it on your own. It is a significant medical decision that must carefully weigh your bone health against, very importantly, your cardiovascular risk. Today, we've unveiled the hidden side of 5 very common types of medications: anti-inflammatories, stomach protectors, decongestants, certain older antidepressants, and calcium supplements. My primary message is not one of panic, and it's certainly not to stop taking any prescribed medication on your own. Doing so could be extremely dangerous. My message is one of empowerment. You now possess valuable information that many people simply overlook. You know that the pill for arthritis might be overworking your heart. You understand that your stomach protector could potentially be impacting your heart's rhythm. You recognize that a simple cold remedy carries unexpected risks. Use this knowledge to become an active, informed partner in your own healthcare journey. The next time you see your doctor, go prepared. Bring a comprehensive list of everything you take, including supplements and vitamins, and ask clear, direct questions. Inquire: "Doctor, I've learned that this medication could have risks for my heart. Is it still the best option for me? Are there safer alternatives? Should we be monitoring anything, like my blood pressure or specific blood tests?" Every treatment involves a careful balance between benefits and risks, and that balance shifts significantly with age. Your heart has worked tirelessly for decades. It truly deserves exquisite care. Protecting it is the single best investment you can make in your future. Do not take any medication for granted, no matter how common it seems. Now, I ask one final thing of you. Share your experience in the comments below. Has anything you've heard today surprised you? Your stories can genuinely help others. And remember always, speak with your doctor. That conversation is the most important step you can take today to protect your heart for tomorrow. Take great care of yourself.